Well, guys, we've all seen a sad deformity of babies' heads where sometimes it's a slight bit deformed, maybe flat in some areas. It actually is a thing. I'm not going to try to say it, but Ms. Hema from Vital Energy can. What is that affliction actually called?
So when the infant is born, sometimes they have a flattening of the head on one side or both sides,
Right.
or they have a conical head, or the head on the top is popping upwards. That's abnormality of the head, and it can be called plagiocephaly or sacrocephaly or brachiocephaly. There are different names for it. That really doesn't matter because it needs a treatment. Any abnormality of the head, that means the brain on one side is going to be squished. And when the brain and neural pathways are squeezed, the normal development cannot happen the way it should be.
Sure. Now,
sometimes they have a torticollis along with that. So that squeezes the head on one side. So they cannot turn on the one side. So they start turning with the whole body. And that also affects their crawling and their normal development. Also, later in the life, if this is not treated by occupational therapists or physical therapists who are trained in craniosacral therapy, it can cause the abnormality of the jaw. It can cause the migraine headaches. It can cause delay in the development. Emotional development also gets affected. They can have a obvious emotional instability. Sometimes they can have sensory processing disorder. Wow. So infants with this type of a problem, if treated early, and there's a lot of self-care that can be done where parents are taught how to lay the baby. Parents are taught how to change the position frequently, how to use the play as a therapy. Sometimes craniosacral therapy is very much needed if it's really compromised. And crystal myofascial release technique that I have evolved has done wonders with these babies. And I sometimes see like adults who are 40-year-old, 60-year-old comes with a chronic migraine headaches in childhood, or they have a locking of the jaw. And then I find the connection that somewhere that baby was not treated right. And sometimes it's too late. Sometimes it's okay to treat and we can still get them better. Sometimes they have a tongue tie and lip tie. So tightness under the upper lip or lower lip or on the tongue. And that can cause a lot of issues, even with chewing of the food or swallowing.
I got to stop right there, Ms. Hema. We're out of time, but the bottom line is if you have a deformed head, that can be treated, and that's an important thing to know. An occupational physical therapist like yourself, right? We appreciate Ms. Hema Dalal from Vital Energy. We're going to put links for you at ABC Columbia because that's a whole lot to take in just a couple of minutes. So we'll make sure we get links for you as well. But you guys stay close. We're coming right back.
Thank you, Tyler.